All right, let's dive right in. Today, we're unpacking a massive scientific review that answers a really important question for millions of people. If I have a health condition or if I'm taking daily medication, can I still get a dental implant that actually works? Well, the answer, based on a whole lot of data, might not be what you think.
So first things first, let's look at the headline number. When you look at over 1 million dental implants, the success rate is absolutely incredible. We're talking over 98%. It's really one of the most successful and predictable things we can do in modern medicine. But, that number is just the headline. Real life, it's always a little messier, right?
Because what if that's you? What if you're dealing with something like osteoporosis or diabetes? Or maybe you take medication for depression or even just for acid reflux. Does that amazing 98% success rate still apply to you? That is the exact question this huge review wanted to answer. And honestly, what they found is fascinating.
To really get this, we gotta back up a second. You have to understand that a dental implant isn't just a fancy piece of hardware we screw into your jaw. No, its success depends entirely on this complex, living, biological process. And that process, it has a name.
It's called osseointegration. And I know, it sounds super technical, but think of it this way. It's like a tree setting deep, strong roots into the earth. It's not just sitting there. It's literally becoming one with its environment. The implant has to do the same thing and become one with your jawbone. So how on earth does that happen?
Well, it's this beautiful four-step healing dance. First, the implant gets placed. Right away, your body's immune cells rush in to clean everything up. Then the real magic starts. These special cells called osteoblasts. Think of them as your body's master builders. They start constructing brand new bone, literally weaving it directly onto the implant surface. And over the next 3 to 6 months, this creates this incredibly powerful living bond.
And right there, that's the whole ballgame. Osseointegration is an active healing process. So the crucial takeaway is that any systemic disease or any medication that messes with your body's ability to heal or build new bone, well, it could potentially throw a wrench in the whole works. Okay, so with that in mind, the researchers went digging. They scoured tons of studies, and the first thing they found was actually a whole lot of good news. A surprising number of conditions and medications that people tend to worry about, well, they actually get a green light from the science.
Okay, pay attention to this, because this is huge. These are all conditions people often think could cause problems. Osteoporosis affecting bone quality, or cardiovascular disease messing with healing. But according to this massive review, there's no data to show they decrease the success rate of implants. This includes osteoporosis, cardiovascular disease, hypertension, hypothyroidism, and even HIV. For so many people, this is incredibly reassuring news.
Let's just zero in on osteoporosis for a second. A huge concern has always been the medications used to treat it, especially a class of drugs called bisphosphonates. But the review is crystal clear on this. For the common, low-dose oral versions of these drugs, the science shows they do not get in the way of a successful implant.
And get this, here's a real curveball. Not only did common blood pressure meds not cause any problems, some of them, like beta blockers, were actually linked with a slightly higher implant survival rate. The data showed a 99.4% survival for people taking them versus 95.9% for those who weren't. We're not 100% sure why, but a leading theory is these drugs might actually help promote bone formation. How about that for an unexpected finding?
But of course, it wasn't all green lights. The review also pointed out a few very common medications and conditions that do act as potential yellow flags. Now, this isn't a hard stop, not at all, but it is a clear sign that a much more careful conversation with your dentist and doctor is absolutely needed. The first of these involves a class of drugs called SSRIs, which you probably know as common antidepressants. Since they're some of the most widely prescribed medications in the world, their potential impact is relevant to literally millions of us, and the research did find a noticeable connection to how well implants do.
So let's just break down the numbers. While people not taking these meds had that super high success rate we talked about, over 95%, people taking SSRIs saw a lower survival rate, dropping to somewhere between about 89 and 94%. Now that's still a high number, for sure, but the difference is statistically significant. So what's going on?
Well, the leading theory is pretty wild. It turns out that our bone-building cells, those osteoblasts, actually have serotonin receptors on them. The thinking is that SSRIs might be activating those receptors and kind of changing how the cells do their job, which could interfere with that critical osseointegration process we talked about. And it's not just antidepressants. There's another extremely common class of drugs that showed a really similar pattern: proton pump inhibitors, or PPIs, which are used all the time for acid reflux and heartburn. Again, the data showed a clear difference.
This time, we're looking at the implant failure rates. For people not taking PPIs, it's pretty low, around 3 to 4.5%. But for PPI users, that rate jumps up significantly, somewhere between 6.8 and 12%. So according to these studies, the risk is roughly doubled.
Now, the hypothesis here is a little bit different. It's thought that by reducing your stomach acid over a long period of time, PPIs can interfere with your body's ability to absorb essential minerals for bone health. And the most important one is calcium. If you have less calcium, you have weaker raw materials for building new bone around that implant.
And what about diabetes? This one is interesting. The review found that the initial fusion, that osseointegration, isn't really the main problem. The bigger issue is long-term. Patients with diabetes, especially when their blood sugar isn't well controlled, have a much higher risk of developing something called peri-implantitis. It's an inflammatory disease, kind of like gum disease, that can destroy the bones supporting the implant over time.
So let's just put it all together in one place. On one side, you've got the clear green lights, osteoporosis and cardiovascular conditions, no significant negative effect. On the other side, you have the yellow flags, SSRIs and PPIs, which are linked to a higher risk of initial failure, and then diabetes, which raises the risk of long-term complications down the road.
So what does this all mean for you? Look, the point of all this science isn't to scare you away from getting an implant. Not at all. It's meant to empower you. It gives you a clear guide for the most important conversation you're going to have before your procedure.
This process isn't just about your teeth, it's about your total health. So you need to be ready to talk about everything. Disclose every single medication, even the over-the-counter stuff. Be totally honest about how well managed your chronic conditions are. And finally, ask your dental team, how are you going to create a treatment plan that accounts for my unique health profile?
Because in the end, knowledge really is your best tool. That 98% success rate is an amazing place to start. But personalizing your care, based on your specific health and the medications you take, that's what truly paves the road to success. So now you know. The conversation starts with you.